Hey everybody, I'm Dr. Martin Benjamin. We're kicking off a new YouTube series called After Surgery WTF. It's a series where we talk about recovery and moments patients may or may not necessarily be expecting after the major surgery.
Could have been 30, could have been a G. Should have never snitched. Why take it to police? Now they're looking at you like food, trying to see what they can eat. Yeah, I'm like, Wallow and Gilly with it.
So kicking off the after surgery WTF is swelling. So it's something that everyone expects after surgery, and it varies between patient and patient, so stay tuned. So kicking off swelling, why does it happen to begin with? Well, you may be forgetting, surgery is literally just controlled trauma. It's your body trying to protect itself, trying to heal itself after that surgical trauma occurs. So every surgery, depending on what you had done, will cause some sort of swelling. And then to make matters sort of even more complicated, every patient really swells differently. Swelling is a way for your body to protect itself, and it's not a complication. It's sort of a part of healing, and it's something we expect. 2, what does normal swelling look like? Well, it depends. So days 2 to 4, usually when patients start panicking after surgery, like, what is this? What just happened? It's common to note that swelling typically worsens at night, and it may actually even worsen with your diet. If you're having a high salt diet in post-op period, that salt's going to retain fluid, so you may be even more swollen than you usually expect. And it can appear in areas that we didn't even operate on, because remember, guys, gravity pulls that fluid down. So healing isn't linear. It comes in waves. Most patients think they did something wrong by around day 3, and that's not necessarily the case. It's just part of healing. 3, what makes swelling worse? Well, very common thing. So if you're not wearing your compression like you're supposed to be wearing, or you're not wearing it long enough, super common. Like I hinted at before, a high sodium diet is going to cause retention of that fluid, make it worse. Being too inactive or being too active can actually worsen swelling as well. And then of course, not hydrating enough. So all these small habits can make a big difference in how quickly you can recover. And it all depends on, how many of these things you're factoring in to your post-op recovery period. So when is swelling not normal in the post-op recovery period? Well, some of these red flags that you got to be keeping in the back of your mind is if that swelling is unilateral, meaning only on one side of that body that you've operated on. So for example, if you've done breast augmentation and the swelling is localized to just one breast, that's a hint that there may be something going on. If the swelling is rapid, if it doesn't occur gradually, all of a sudden you wake up and one breast is significantly bigger than the other, you got to call your plastic surgeon because there may be something else going on. If that swelling is associated with heat, redness, or fever greater than 101.6, it's typically something you got to be calling your plastic surgeon about. And if there's severe pain, just out of proportion to the exam with that swelling, it means there's something definitely going on. Number 5, now that you've had swelling, what can you do to help reduce some of the post-op symptoms of swelling? Well, staying consistent with the instructions that your plastic surgeon gave you, and that's typically compression and how many hours a day you should be wearing it. Having a low sodium diet, high in protein, low in carbohydrate in the post-op period. Of course, walking, ambulating is super important to help with your blood circulation, decrease the chances of blood clots. At the same time, it actually helps with the swelling. And of course, booking lymphatic massages, super important. Depending on that procedure, especially if it's a liposuction or a tummy tuck procedure, you gotta have somebody physically milking that tissue to help you recover that much faster. Thanks for watching, guys. Comment on any recovery topics that you'd love to get a little bit of a video on. Anything from bruising to drains to compression, after surgery, WTF, right? Stay tuned for the next episode on bruising.